Yes, good afternoon, officers. Time for a short video. Very important topic for accidents on highways and all these things. So, the topic for today is the golden hour. Most important to protect a human life, especially under accident scenarios on highways. So, what is the main issue? If you observe, జాగ్రత్తగా చూసుకుంటే, the golden hour. Fast medical intervention saves lives. So, what are the concepts involved in it? Increases survival rates, reduces complications, manages blood loss, improves long-term outcomes, and finally prevents secondary injuries. So, all of these things are beautifully interlinked with each other. And finally, saving lives is the whole concept. That is the reason it is called the golden hour. The first 1 hour after accident is very important for protection of a human life. So keeping that in mind, a short video, very important for administrative as well as governance and future policy making also. So what are all the important things in it? Let's have a quick glance at the statistics first. So here the statistics are: the golden hour is the first 60 minutes post-trauma. Delay will lead to life as well as death, cardiac arrest, strokes, and road accidents. That is the first hour, first 60 minutes. Cities like Delhi now show an average ambulance response time of 17 plus minutes. In 2014, it was only 13 minutes. Now it increased to 17 minutes, which is dangerous. Rural areas fare worse due to infrastructure gaps. Bengaluru, Mumbai and Delhi face severe delays. Karnataka crash victims lack timely care. 6,000 plus had delays over 30 minutes. These are all the important statistics with respect to. So the problem is traffic congestion is one issue, roads width and length is another issue, and response of the ambulance is another issue. So keeping that in mind, that first 1 hour, how to go ahead, we'll see. GPS real-time ambulance tracking, very important, which is happening already in Chennai and Kolkata. Response time cut by 12 minutes, which is 12 to 15% తగ్గిస్తుంది. దానివల్ల better CT scan times for stroke victims. That's very important. So for this GPS real-time, so that's the first point you can mention. Smart signals, second point, allow ambulances to trigger green lights and reduce journey times. Then a few Indian cities currently implement this. So what happens is, if an ambulance is coming, automatically, though there is a red signal on the traffic, because of the ambulance, the signals, smart signals center matter. So because the ambulance is on the way, automatically traffic divert chesi, the signals red, anni green AC, fat report the ambulance. It's very good for protecting the life of the patient. Next, bike ambulances, very important. Eppudu van avasam ledhu, bike ambulances, especially in Bangalore, 1/3 trauma cases ni protect cheyadam jarigindi under 6 minutes. So very important things. So here is the third point. So if you observe, major features are GPS real-time tracking of ambulances, smart signal systems, and bike ambulances. These are the major 3 points we can put in our answers. Next, let's look at all the concepts which are involved in this. Golden hour concept into the explanation. Critical window post-trauma where survival chances are maximized with early care. Concept, example, stroke victims receiving care 60 minutes have 2 times better recovery chances. So that's the main point. Next important concept, preemptive, and before something happening, signal systems. AI-based systems that turn green for ambulances, very important concept. Singapore, Amsterdam and pilot tested in Pune also. So this is one beautiful example you can definitely mention. Preemptive signaling system, very important. These are smart ways to protect lives. Next, GPS integrated tracking ambulance, real-time tracking enabling hospitals to prepare and traffic control to support faster movement. Tamil Nadu already 108 emergency service varthunai. So it's another beautiful example which is already working. So first, second, third, and bike ambulances, motorbike based ambulances, traffic better and faster. So there's another fourth way to deal with this problem. Bengaluru is Jeevan Rakshak. That's the point that you have to mention. Used successful, especially during COVID. This one example, you can mention all these points in your mains that it's already been working. Next, traffic infrastructure deficiency, that's a big problem. Less than 20% of urban roads support smart signal tech. Ippudu kuda manual nadustundi, should become smart. So there's another fifth point which you can mention. Bad in tier 2 as well as tier 3 cities. This is statistics that you can mention here mains. So this smart signaling, all these first 4 points should move to tier 1 and tier 2, tier 3 cities ki shift ayindante appudu real impact manaki baga telustundi. Moving on, less than 20%, very interesting facts. Let's look at it. Less than 20% of urban signal support is a very bad thing. 62% of drivers don't yield to ambulances, another bad thing. Frequent GPS glitches, signal lags, outdated road data, this is another bad thing. Few Indian cities have adopted smart traffic tech, this is a very good thing. Ambulance fleet growth is not equal to response time. So this is bad thing. So here is only the star point. So signal, GPS system problem, 62% don't yield to ambulance. Ante road మీద ambulance వెళ్తుంటే పక్కకు జరగరు, అది పెద్ద ప్రాబ్లం. Next, Indian GPS glitches, signal lagouts, outdated road data, dangerous. Smart traffic tech ఇంకా వాడట్లేదు. Ambulance growth is not equal to response time. All these are dangerous things. Only one, very few cities. Next, let's look at some interesting data with respect to what countries have already adopted. So మనం కాపీ పేస్ట్ చేయాల్సిన ఎక్కడెక్కడ ఉన్నాయి. సింగపూర్లో they use smart traffic signals plus 5G based ambulance routing. This one you can use. దానివల్ల 8 minutes reduction EMS response time. This can be mentioned in your mains. Next, South Koreaలో ఎట్లా చేస్తున్నారు? Drones for ambulances. Average dispatch time by 20% in Seoul. So this is also very useful. You can mention these examples in your main saying that this can be done in India. Next, Netherlands లో ఎట్లా చేస్తున్నారు? Preemptive lights plus connected traffic ecosystem. దానివల్ల 100% green corridor routing in emergencies. It's a beautiful thing you can mention in your mains. చాలా important point. అట్లనే టెక్సస్లో ఎట్లా చేస్తున్నారు? Ambulance hospital telemedicine integration. Here teams get live vitals and footage on route. So ambulance ఉన్నప్పుడే మొత్తం అన్ని లైవ్ ట్రాకింగ్ చేసి వచ్చేటప్పటికల్లా by the time the victim comes to the hospital everything is arranged. So by the time he comes అప్పుడప్పుడు ఇప్పుడు మనకి ఇప్పుడు హాస్పిటల్కి వెళ్తే ఫస్ట్ చెక్ చేసి ఏంటి కథ కనుక్కొని అన్నీ చేసేప్పటికల్లా పైన పోతాడు. బట్ యుఎస్లో అంబులెన్స్ ఎక్కగానే లైవ్ వైటల్స్ ఎవ్రీథింగ్ చెక్ చేసి ఇట్స్ ఆల్ సింక్ టు ద data centers which are present in the hospital. So the doctor is ready with all the data and all the equipment. So the minute the patient walks in, patient comes in, the treatment is done immediately and saving the beautiful life of that particular patient. So these are all beautiful examples you can definitely mention for all your mains. Mains ki చాలా important. Look at this ఒకసారి మళ్ళీ quick గా. సింగపూర్లో స్మార్ట్ ట్రాఫిక్ సిగ్నల్స్ 5G based. South Korea lo they are using drones. Netherlands lo preemptive lights and connected traffic ecosystem. Texas lo ambulance hospital telemedicine integration. These are all the points you can mention for saying that this is what India can do and India can actually do better. So these are all the things which are very useful. Next, what are the other things which can be included in this whole point? Let's quickly have a review. GPS dispatch software primarily, 5G and IoT enabled traffic signals we can do. Real-time mobile apps for public alerts, emergency vehicle detention systems, two-wheeler rapid response units, AI-based hospital pre-notification systems, geofencing of dynamic route allocation. EVAR, all these schemes you can use for making sure the golden hour works. Golden hour panjalante, depending upon the state's dynamics, depending upon the infrastructure which is available in those states already, you can use any of this dispatch software, 5G and IoT enabled traffic, real-time mobile apps for public alerts, emergency vehicle detection system, two-wheeler rapid response units, AI-based hospital pre-notification, geofencing. All these concepts very useful for your mains as well as for your prelims. Ronditki chala important idi. So adi kaakunda stroke cardiac trauma deaths could be reduced by 30% with timely access. Timely ambulance arrival reduces litigation risk of hospitals. Cities need to integrate traffic and emergency response planning. High-tech solutions aligns with India's G20 focus on digital public infrastructure, DIP Center. DPI, sorry. So digital public infra, DPIs. Very important. So all these things can be integrated with digital public infrastructure. Even improve cheste technically everything becomes a smarter city. So India lo em jarugutunna okasari quick ga chuddam. What is the program, what is the objective, and what is the coverage that they are doing? Let's have a quick glance at all these things. First, National Ambulance in 108, Emergency Medical Response by 108, operates in 20 states. This is the current state. Next, Ayushman Bharat PMJY covers treatment costs for post-accidents indirectly dependent on golden hour access. 50 crore beneficiaries already being done. Smart cities mission kuda improve chestadi. Urban mobility improvement includes smart signals and traffic digitization, but only limited rollout. Next, e-Sanjeevani telemedicine, remote doctor access for rural patients could be linked with en route ambulances. All these things can be done with respect to India. So look at the first, second, third, and fourth point. National Ambulance 108, PM Ayushman Bharat, Smart Cities Mission, e-Sanjeevani telemedicine. These are all the programs that are already running. Next, preemptive traffic signal integration should be standard. Alerts public approach ambulance. So this is the whole point. And Google Maps inka ways rendu vaadachu, particularly congested metros and narrow rural lanes ki chala panikostundi. Google Maps and ways. Mandatory awareness drives through RTOs should be done, and schools lo kuda all these things should be clearly mentioned. Strict fine and CCTV monitoring should not be yielding to ambulances. So these are all the major points. So preemptive traffic signal is very important. Public on approaching, especially through Google Maps, congested areas, mandatory awareness, schooling slow training programs, and CCTV and strict fines should be there. So this golden hour is golden for protecting of the life. Therefore, these are all the points with respect to golden hour. Very interesting and very, very, very important for saving lives. So I hope all of you have got the video. Just quick glance kodam okati major points em cover chesamu. So 108 Ayushman Bharat, Smart Cities, e-Sanjeevani telemedicine, then GPS software, 5G and IoT enabled traffic signals, apps, detection systems, emergency detection systems, two-wheeler rapid response units, AI based hospital pre-notification system, geofencing, very, very important points. So these are all the points you can directly mention and include it to digital public infrastructure, DPIs. Then 30% reduction, litigations, integrations, digital public infrastructure. Then what are the examples we can give which are already working throughout the world? Global technologies. Singapore, traffic signals. South Korea, drones. Netherlands, preemptive lights plus connected traffic ecosystem. Texas, ambulance hospital and telemedicine. These are all the points you have to mention. And then concepts, golden hour, preemptive signal systems, GPS integrated ambulance tracking, bike ambulances, traffic infrastructure, what are the deficiencies? 20% of urban roads only utilizing it. So tier 2, tier 3 cities is spread cheyali. And finally, ikkada manaku vaadedi Chennai, Kolkata lo GPS systems are using smart signals, ambulances, bike ambulances in Bengaluru. These are already being used. And golden hour definition, first 60 minutes, Delhi, problem, Bengaluru, Mumbai. Look at the statistics. So if you use golden hour and use all these technologies, what are the benefits? Increases survival rates, reduces complications, manages blood loss, improves long-term outcomes, and preemptive secondary injuries, annitni protect cheyachu. And finally, we have to save a life. One life, one family. Very important. I hope all of you enjoyed the video. If you like it, please share, subscribe, comment, and please learn. And the only work you have to do, revise, revise, revise. So that's all for today. Have a nice day. Take care. Shamanth Pydikondala signing off. Bye-bye.